I'll be going over the axial skeleton today. So first thing I wanted to point out were the cranial bones. This is the frontal, the two parietal bones, the temporal bones, and on the back is the occipital bone. This is the external occipital protuberance, which serves as the insertion site for the ligamentum nuchae. This is the temporal bone. This is the squamous part, the mastoid process, the styloid process, the temporal mandibular joint, the external acoustic meatus. So here, this is the petrous part of the temporal bone that has the middle and inner ear for balance and hearing. This is the internal acoustic meatus that transmits the cranial nerves 7 and 8. Going over the sphenoid bone, this is the lateral view, and this is the orbital view. Together makes the greater wing. Inside here would be the superior orbital fissure that transmits the cranial nerves that control the eye, so that would be cranial nerves 3 through 6. Inside here, the internal view would be the greater wing and the lesser wing, and then this is the optic canal that transmits the optic nerve and the ophthalmic artery, and this is the sella turcica that cradles the pituitary gland. The ethmoid bone, I'm going to go over the internal view. Ethmoid bone, this is the crista galli, which is the attachment site for the meninges that cover the brain. This is the cribriform plate that transmit bundles of axons called the fila olfactoria. I'll go over the sutures. This is the coronal suture. Coronal suture that connects the frontal bone to the parietal bones. The sagittal suture connects the two parietal bones. The squamous suture connects the temporal and the parietal bones. And the rhomboid suture connects the occipital bone to the parietal bone. To go over the facial bones, this is the maxilla, and this is the alveolar process of the maxilla. This is the nasal bone, the zygomatic bone. The zygomatic bone and the zygomatic process of the temporal bone create the zygomatic arch. This is the vomer in here. The vomer and the ethmoid bone connect here to create the nasal septum. Also in here would be the the inferior nasal concha, which creates air turbulence to warm, cool, or humidify the air before it reaches the lungs. And the next one that I want to go over will be the mandible. This is the mandible. This will be the body of the mandible. The angle, mandibular angle, this is the ramus, the coronoid process, mandibular notch, and the mandibular condyle. Okay, and let's see, to go over the vertebral column, there are 4 curvatures: the cervical, thoracic, lumbar, and the sacrum. The thoracic and the sacral curvatures are the primary curvatures. The cervical and the lumbar curvatures are the secondary curvatures. The cervical vertebrae there are 7 of them. The first one is the atlas that articulates with the occipital condyles to permit a nodding movement. Again, there are 7 of them, and the transverse process of the cervical vertebrae are unique because they contain foramina. The 12 thoracic vertebrae are here. This would be the spinous processes. On either side would be the transverse processes. And this is the body here, and sandwiched between the body, or the centrum, would be the intervertebral discs. And here, the gaps here, you can see, The gaps here would be the intervertebral foramina, which allows for spinal nerves of the spinal column to pass through, or the spinal cord to pass through. And again, if I didn't mention it, I'm not too sure, but the cervical process again are unique because the transverse processes do contain foramina. Next we have the lumbar vertebrae. There are 5 of them, and then the sacrum has 5 fused vertebrae and the coccyx. This here would be the sternum, and this is the jugular notch, the manubrium, the body, and the xiphoid process. Lastly, I want to go over the ribs. The ribs have the head here, the neck, and the tubercle. And the ribs articulate with the vertebrae via 2 facets, one connecting with the same number of thoracic vertebrae, the other facet allowing for connection excuse me, with the body of the vertebrae that's superior. And there are 7 pairs of true ribs. 1, 2, 3, 4, 5, 6, 7. Pairs 8 through 12 are the false ribs. 8, 9, 10, 11, and 12. 11 and 12 are the floating ribs. And that's pretty much it. Thank you.